Greetings, everyone. Some people make a great first impression and keep maintaining that impression as time goes by. Dr. Claire Zoellner is one such individual. I first learned of Dr. Zoellner, she was Claire then, when she was part of this IFT Student Association product development team that developed squashetti. Remember that, Claire? Those noodle-like strands
Yeah.
of squash.
Yeah.
Things come back to haunt you. You always have to be careful. So this team had developed noodle-like strands of squash as a low-calorie, allergen-free alternative to pasta and noodles. And someone at IFT sent it along to me because they knew I had written a book on pasta and noodles, and they thought I would be interested, and I was. Well, today you see it everywhere. Claire's name would just pop up in a number of different platforms, and she's always been someone to watch and listen to. Today, she juggles motherhood as a mother of 2 young children, editorship of the Phi Tau Sigma newsletter, and she's also working full-time as a food safety scientist at iFoodDS. So iFoodDS is a food safety, quality, and traceability company, and Dr. Zoellner uses her expertise in microbial contamination, simulation models, and risk assessment to manage their environmental monitoring solutions product line. Prior to iFoodDS, she held a postdoctoral research appointment at Cornell University, working on modeling tools to address the risk of listeria contamination in frozen foods. She has a BS in food science and human nutrition just from around the corner, University of Illinois Urbana-Champaign, and a PhD in food science and technology with minors in epidemiology and systems engineering from Cornell University. The title of our talk today is Approximating the Needle in the Haystack, Using Simulation Models to Improve Food Safety Controls. Please join me in welcoming Dr. Claire Zoellner.
Thank you, Kanta, for that introduction. I was not expecting the squashetti product development competition to come up. So nice, that gets me smiling here as we get going. So hello, everybody. My name is Claire Zoellner, as Kanta introduced, and the title of my seminar, as she mentioned, is Approximating the Needle in the Haystack Using Simulation Models to Improve Food Safety Controls. And what I hope to convey over the next hour or so is how models can supplement historical or real-time food safety data with simulation to provide more context that can inform efficient allocation of food safety resources for actual manufacturers in the industry. And I'm going to present my background, my research interests really as they relate to a larger vision of translating these innovative tools into products and services for the industry. So not quite exactly, I'm going to speak a little bit about what I do at iFoodDS, but we're not really there yet in terms of scaling simulation models. So it's a little bit of a visionary talk here on where I feel like we could create new products and solutions, and hopefully have time at the end for some discussion. So how are we doing? How are we doing at controlling food safety risks and preventing foodborne illness? Those are the ultimate goals of researchers, regulators, practitioners in food safety. And the U.S. Department of Health and Human Services actually has this Healthy People 2030 initiative to set data-driven national objectives to improve health and well-being over this decade. And one of the health conditions they're focused on is foodborne illness. And I think this helps explain some of the priorities that we're seeing come out of USDA, FDA, CDC, and even industry associations around food safety goals. So they're updating their website on how we're doing as we progress towards this 2030 deadline. And so what you can see here is, how are we doing at reducing infections caused by salmonella? USDA is super focused here, and we're seeing improvements. Infections caused by Campylobacter, Shiga toxin producing E. coli, seeing little or no detectable change. And actually, where I've spent most of my time infections caused by Listeria is actually getting worse. Now, of course, other innovations that perhaps some of you all are working on, like novel processing techniques, whole genome sequencing, traceability, rapid detection methods, all of these are related to driving down these numbers and improving, reducing infections in these areas. But for the purposes of this talk, I'm focused on data tools that can help us approximate risks and prioritize interventions in these areas, which is, I think, in line with, again, the strategic goals and initiatives coming out of USDA and FDA. So maybe you're already familiar, USDA has their strategic plan for 2023 to 2026. And the FDA has come out with their new era of smarter food safety. And across both of these organizations, we're seeing themes around innovation, data, efficiency, compliance, collaboration, coordination, digitization, resource targeting, both within their organizations as they regulate. They're trying to modernize their systems, but also they're asking the industry to modernize at the same time. And I still feel like, that's great. We need that, but there is a gap. I mean, this is the reality. This is where food safety managers are working to produce, harvest, process our foods in these kinds of environments. How can we help them implement new approaches, new technologies, make data-driven decisions, better manage food safety risks? What information do they need to be more efficient? Is there really a silver bullet that can give them more peace of mind when they leave work each day? Because we know, they are worried about causing illness and worse hospitalizations and deaths. So that's where I'm focused. And of course, there's a bunch of existing solutions, right? I work for a software company, and like other sectors who have gone through this digitization, there's a bunch of solution startup providers. Some are very small. These are kind of the big buckets that we see existing technology for food safety, quality, traceability, supplier management, document management. But these are often focused on compliance and documentation, gathering information for just the tasks that they're doing day to day that they have to report out on for an audit, which is important. I'm not wanting to diminish that, but it's, initially was targeted around replacing a clipboard and paper and filing cabinets. So not necessarily for purposes of getting smarter or more efficient, right? It was just kind of recreating our workflow on paper. So we're starting to see more of analytics and data visualization tools so that, we can actually look at this data we're collecting. But I kind of argue, or my viewpoint is that this compliance data can be leveraged in another way, so that food safety practitioners can more proactively assess and address and ideally prevent contamination. So we can use simulation models to create and analyze a digital prototype of the physical system so that we can better understand conditions that lead to contamination, predict the likelihood of pathogens in our environments, and simulate different scenarios in order to prevent them, but set performance metrics and things that we can measure or act upon. So maybe not find the needle in the haystack, but that's where I'm saying we're approximating, where we should put our resources, what are our high risk areas, and can we maybe get more information out of this data that we're collecting. So that's kind of what I want to talk through over the next hour. I have a slight, I'm going to take a slight detour for the first part of this to kind of introduce a bit, again, what I'm doing right now for a software company, as it potentially might relate to an interesting career track or career area for food science students that are interested in data or technology or these kinds of tools. And then I'll get into my experience in developing some of these proof of concept simulation models on a research scale, and then finish up with an exciting project where we actually have made a somewhat scalable solution that is publicly available. And so kind of walk through a case study on that. I think we'll have questions towards the end. I'm not monitoring the chat, but I guess if you have a burning question, you can interrupt. But yeah, I'll look at the chat towards the end if you have questions. So as Kanta introduced, I'll go through this quickly. She did a really good job overview of my background. I am originally from South Side of Chicago, so very excited to be speaking with you all at IIT today. I went to the University of Illinois in Urbana-Champaign. Got a bachelor's in food science and did a couple of internships in product development during my undergrad, and realized I was more interested in food safety than in product development. So I wanted to kind of specialize more in food microbiology and food safety. So I continued on to grad school at Cornell, got my PhD in food science, and I had the opportunity to be part of a national needs fellowship that in international food safety that required me to do part of my research in another country that was a major trade partner. So I actually went and lived in Mexico for a year. I'm going to talk a little bit about that research project, but essentially was following the supply chain of Roma tomatoes from Mexico to retail stores in the United States. I stayed up at Cornell for my postdoc, but pivoted to a research project funded by the Frozen Food Foundation. Again, after some outbreaks in frozen food products, frozen food industry was a little bit worried about listeria and the options for controlling listeria in frozen food products. So that was my postdoc work. And in presenting through that association, AFI, the Association of Frozen Food, American Frozen Food Institute, excuse me. Their members were very interested in these modeling tools and kind of were suggesting that we look at, how do we make them available? And so I had the opportunity to go through this NSF iCore program I'm going to talk about briefly. And that's how I got introduced to iFood DS. And so as she mentioned, I'm currently working as a food safety scientist and really a product manager for the environmental monitoring solutions at iFood DS. And I'm still involved in research. So again, we're going to hear a little bit more about some of these as we go on. But this is kind of my first plug for anyone interested in entrepreneurship. This is a very cool program that is at the national level, but there are also regional, what they're calling nodes. So Cornell had the upstate New York iCore node. I should have looked up, I'm not sure where there is a Midwest node at Purdue, but I'm not sure if there's something available in Illinois. But essentially, NSF realized that public money funds a lot of research, and their goal is that research comes back and the public gets benefits of that research. So we need to help researchers see the commercial potential of their inventions. And so this is essentially a crash course for researchers in business models. It's an immersive entrepreneurial training program, 7 weeks. They give you money. They give you $25,000 to go out and interview 100 potential customers and really just refine what you see here on the right is a business model canvas. So what is your innovation? Is it, who is it for? Who is the potential end user? Who's the customer? What are their problems? And does your innovation solve their problem, right? So you're trying to refine the product market fit, which is critical for launching, a new company or new innovation. So just putting a plug out there for anyone interested. I actually went through it with my PI, and just the whole process of getting out of the lab, sharing your research and understanding if it's, solving someone's problem was very cool. And we did find that there was potential. We weren't going to go launch a company, and my PI wasn't going to leave academia to pursue this, but we did meet iFood DS, and they were interested in licensing our technology and hiring me to kind of continue working through how we could make this into a commercial product. So iFood DS is as Kanta mentioned, a cloud-based food value chain software solution provider, quality, food safety, traceability. Our mission is relentlessly pursuing a better food supply. We combine collection of food safety, quality management, traceability data across the supply chain. Everything is in the cloud, right? So we're trying to support transparency and sharing of that data through the supply chain. We work with growers, processors, packers, distribution centers, and have a lot of large retail customers that want this information from their suppliers as they're, selecting product to buy. A little bit more, we started in 2004 as a consulting company in the fresh produce industry. And after a couple of outbreaks and working with the industry through those outbreaks, realized how beneficial kind of software solutions would be at managing the extensive data around food safety programs and compliance. So again, lots of the solutions are around documentation and compliance and organizing all of that in the event that you need to go through, an investigation. And so in 2013, they kind of launched the iFood Decision Sciences company, which was the software side of the business. And then most recently in 2020, we acquired HarvestMark, which was previously under Trimble Ag, as a leading provider in food traceability and quality solutions. So putting QR codes and traceability codes actually on clamshell packages and connecting food safety data to that and providing that to a consumer or to a buyer. So that kind of completed our supply chain platform for working end to end in the supply chain, but also the buckets of safety, traceability, and quality. We have around 90 employees, so still small, still considered a startup. And we have offices in Seattle, Washington, Monterey, California, and Scottsdale, Arizona. And what I do, my title is food safety scientist. I'm still partly like a subject matter expert for the company, but I'm also wearing the hat of a product manager. And this is what I want to introduce to food science students who may not have thought about this. I certainly didn't know about this when I was a student or even a grad student. And so a product manager is responsible for the overall strategy, direction, and delivery of the product. When we're talking about software, it's a software product, but there's certainly product managers in other industries as well. And really, you just have to deeply understand the needs of the customer and your target market or target user, and then translate those into the different product features, priorities, and requirements that you're going to deliver over time. So I manage a team of software engineers, and they don't know what a food safety manager needs to do day to day. But so that's what I do. I tell them, okay, this is the use case. This is how they're going to use this software tool. This is the data they need to collect. And then that's kind of how we build out features. Think of the apps that you use every day. There's a whole team of people behind developing that app and what are the requirements. And so again, it's just understanding the market needs and the customer, but maybe not a consumer of food, but maybe your end user is actually a food safety manager. And then I work with marketing and sales to support, getting customers or to support existing customers. I did find one data point for median salary for a product manager, which is pretty good compared to, I think, what you would find for a median salary of a food safety manager, but just putting that out there as a ballpark. And then the career track, you might actually start as a technical product manager supporting a product manager, and then there's advancement to senior product manager, and then the executive level is like a VP of product where you're managing an entire portfolio of software products. And so just trying to showcase this career opportunity, some maybe qualities of a product manager: tech savvy, customer obsessed. It's mostly working in remote teams. These days, software companies are remote, and we follow stay agile. So being able to pivot and in different directions, juggle a bunch of different things, but that also describes how that's also a methodology of how software is developed in kind of 2-week increments. We call it working in agile. So happy to talk more offline about this if this is of interest to anyone, but just wanted to briefly describe what I'm doing at a software company. Okay, so now getting back to kind of the meat of the talk, I'm going to go over, again, some of the learnings that I went through in developing some simulation tools from more of a research perspective, and how they really have set us up for success in the final case study that I'll show. So there's 3 tools I'm going to walk through, and all tools kind of need an acronym. So there's kind of a alphabet soup over here, but the first one is post-harvest supply chain with microbial travelers. Second one is environmental monitoring with an agent-based model of listeria. And the last one is a frozen food listeria lot risk assessment model. So in this section, key takeaways. So you might already have this perspective, or maybe you've heard, all models are wrong. I kind of prefer to position it around all models have limitations, right? We understand that a model is a simplification of a system that we're trying to study or recreate. So, we're going to make assumptions, we're going to make simplifications, because otherwise we actually have the same system. We need a model to study off of. So we should be transparent in those limitations, and that's kind of the lens that you would view the utility of the model in. So having said that, I still hope to demonstrate that there is a place for simulation models in food safety decision making. Again, whether you're a researcher or policymaker, or actually boots on the ground implementing food safety controls. And kind of 4 areas that I'm going to highlight, or use cases, are visualizing contamination pathways, right? We're modeling microorganisms that you can't see with the eye. And so if you're training your employees on practices and they just can't connect with how their behaviors actually transmit microorganisms from point A to point B, that's a barrier, right? So these tools are really cool in visualizing how microorganisms might be behaving or moving. Conducting virtual experiments. Again, I mentioned, you might have other ways, right? We have pilot plants that we use to conduct experiments that aren't actually production floor. You have benchtop experiments. This is just another way to study. We can't inoculate food processing facilities with pathogens or even indicators to do these kinds of experiments. So models can provide kind of a virtual platform to run different experiments. In building these, we often challenge our mental models, I like to call it, our mental assumptions, right? So if we're going to have to take a system and say, how would you break this up into steps, or how would you represent this with a mathematical equation? We're going to uncover a lot of unknowns and gaps. And, that's an important part of problem solving. And lastly, of course, we are going to quantify risk. We have the ability to put numbers to these behaviors and these outcomes, and give you an actual action point. What's the probability or likelihood of that something will happen? So the first model, this is the work that I did during my PhD, partly in Mexico. So we are studying, this is an observational kind of pilot study. We were interested in looking at how microorganisms change on a product as it moves through the supply chain. Very difficult study to set up, but we're looking at Roma tomatoes that were harvested in greenhouses and fields in Mexico and being imported into the United States and sold at retail supermarkets. And so we were following the actual lot codes that were put on by the farm and taking samples of tomatoes within that lot at 4 different locations in the supply chain, and then analyzing the surface of the tomatoes for indicator microorganisms. So aerobic plate count, total coliforms, yeast and mold, generic E. coli. And just highlighting here kind of the 2 big takeaways as they relate to, the need for a modeling tool was time and conditions in the supply chain were impacting the microbial populations differently. So we see here, aerobic plate count generally increased from harvest to supermarket, whereas total coliforms seem to kind of be introduced, die off, and be reintroduced, or maybe it was introduced, kind of controlled, and then grow. So, it depended on the microbial indicator, what was going on in the supply chain, which was interesting. And the second one is large variations. So you see in these box and whisker plots, the whiskers are showing really the variation within each supply chain location, the outcomes that we were seeing. And partly due to the fact that this was very challenging experiment to implement, but also just it's very difficult to maintain conditions within supermarkets and distribution centers and packing houses. And this really suggested challenges for these different locations and potential opportunities that we could study to improve food safety controls. We certainly weren't going to repeat this and look at interventions. That was a very time and resource intensive study and just logistically challenging. So we said, okay, we could use simulation we could recreate the supply chain and study what's going on at these different locations in a model. So the method here was what's called a modular process modeling approach. Essentially, we're breaking down the different functions or behaviors into modules, and then giving you the ability to kind of recreate or assemble those modules in whatever order represents what's going on in your supply chain. So for example, the modules were, okay, we can introduce contamination. Contamination can be transferred on surfaces. It could be removed, right? If you have some wash step or a kill step, or it could grow. So there's kind of the 4 processes that we could have. And then depending on your supply chain scenario, those might appear in different combinations or iterations. So you can see here this figure down at the left, kind of how we broke down what was going on in each of those supply chain locations in terms of the order and number of modules that we wanted to include. So this was kind of a generic modeling framework that could be, it was intended to be applied to any fresh produce supply chain. And then, you would introduce contamination and see how it would change throughout the supply chain. So on the right, you can kind of see some of the data outputs or giving you the concentration in the product by kind of module per day, or the time step could be an hour or a minute. So detailed data about the concentration of the microorganisms. You can see peaks and valleys, and then we can change those parameters or change those modules and see how the system changes. So again, this is a user interface that anybody could make their own supply chain with. And the learnings here were that we were able to recreate the pilot study. So I'm showing you again those same figures. What we observed for aerobic plate count and total coliforms in the supply chain, and side by side with that is our model results in the darker colors. So we could compare. I don't know if you can see my pointer, but we could compare the dark line in the middle of the box plot is like kind of the median value. And so that's what we were kind of using as our validation point. But we were unable to match the variability that was going on in the supply chain. And in general, this model was just very difficult to parameterize and validate for a number of reasons. But our main conclusion was that perhaps it was too generic, right? This was kind of a framework that we could use, but it was deterministic. We weren't incorporating any probabilities, and that limited the extrapolation and variability that we were going to see. And there's the parameters that existed in literature were difficult to match to the parameters that we were including in the model. So it was limited in its ability to capture the entire scope of reality of what was going on in the supply chain, and mainly used just to visualize contamination dynamics and yeah, I think it was more proof of concept. We positioned it as a framework. So the next model that we came out with, again unrelated, but transitioning to environmental monitoring for listeria. Again, this came out of the frozen food industry saying, there's now a risk in frozen foods after the Bluebell ice cream outbreak, after frozen vegetable recalls. They wanted more information on how to control listeria in their operation. So my first step was, I think there's a lot of information out there on environmental monitoring and listeria. And actually, we did a systematic search and we found 268 references. These ranged from guidance documents, government guidelines, research papers. I'm showing here in this table how they span different sectors, mainly meat, dairy, and seafood. But still, there's a lot of information out there already. But the questions that the industry had were, how do I design a risk-based, science-based program, even with all this information? How many samples do I need to take in my facility? Am I sampling in the right areas? Which strategy is best for my facility? So again, a gap between, okay, we've got all this information out there, but they still need to tailor it to their operation. And how can we help them do that? And so again, we came up with, okay, well, let's build a model. This is going to be hard to study in every facility, but maybe we can use computer models. So this is, I have a video playing here. This is an agent-based model. So this is kind of, we swung the pendulum. The first model I showed you, I'm going to pause this just for a second. First model I showed you was kind of a generic framework where you could kind of play around with it. This one is completely, it's still customizable, but very specific to a specific facility. You can see here, we're recreating a food processing facility in silico to scale. So this is using the floor plan on a square foot by square foot basis. We're recreating what is in that facility in terms of the equipment surfaces. You see here workers, you see water, you see traffic, and three-dimensional. We've got what's on the floor, what's the equipment on top of that, what's on the ceiling. And this is highly detailed, and it's called an agent-based model because you represent all of these components of the model independently, and you have a kind of a rule-based algorithm in the background that allows an agent or component to make decisions over time, and that gives us kind of organically the dynamics you would see in the system that we wouldn't be able to model otherwise. We can't put an equation to it. So this is very complex to build, but gives us a lot of really a lot closer realism to what's going on in the actual system. So we simulate, I'll continue playing this now. We simulate production over time in this facility. Essentially what we're saying is, okay, how would Listeria come into this food processing facility? And if it does come in, where does it go? How much is there? How long does it stay there? Is it removed? Where did it come from? Where did it go? And we're collecting this data. We could simulate months, years, and collecting this data for each of these agents or each of these points in this facility. Again, we parameterize this with available literature. Where we didn't have available information, we actually conducted an expert elicitation. And then because we built this for a specific facility, we went and took measurements and observed the facility practices over time. And so this is the best example of how, we were showing the facility where Listeria might be moving. I don't know if you can tell, but there's kind of yellow bugs that is the actual Listeria. Moving through, if it starts here, basically where the raw product comes in, and it goes through a wall here to get onto the production line, we can see through this network how Listeria might be moving through the facility. And so this was super cool to put in front of some employees in this facility, and then just, put a, significance into what they're doing day to day. Why do we have barriers, in the production environment to prevent this transmission? So learnings from this model, again, we kind of swung to the other end of the spectrum. This is a highly detailed model to build, a lot of inputs, highly stochastic, long simulation times. It's a big model, but it gives us a lot more rich data set than we would be collecting with just sponge samples on a surface. It gives us kind of a big data set that makes for some really fun data analysis. We can start using some machine learning tools because we've got a rich enough data set. So here I'm showing you 3 kinds of outputs on groups of surfaces and equipment in the modeled facility. So you can see, for example, across the hand tool, the employee tools they're using, or mobile equipment, metal detectors, flumes, drains, and we're showing you the probability that equipment is contaminated at the middle of the shift, which is the recommended time for conducting environmental monitoring. And then although nobody is quantifying listeria in a sponge, right? We enrich it, we get it's there or it's not. But if we're talking about transmission through our environment, the level does matter, right? If it's one cell, it's probably not going to be moving across the whole facility. Whereas if it's thousands of cells, hundreds of thousands of cells, right, that's something that could spread far. So we're giving the level of contamination on the piece of equipment. And then lastly, how long it's consecutively contaminated. So coupled with the floor plan on the first slide, the previous slide, you can kind of start to see how this tool gives output that, you know, a food safety manager could reallocate their resources based on, okay, I'm going to focus on, if I'm really in the culture mindset of I'm going to find listeria and make sure it's not there. Okay, I'm going to look at the highly contaminated, highly probable sites that have high levels and are contaminated for long periods of time. So again, this model, although it was big to build, was very useful for visualizing contamination and kind of quantifying risk so that they could reallocate resources. The second thing that we did with it was start to run different experiments. So again, trying to answer those questions. How many samples should I take? Where should I look? Again, there's guidance out there. We looked at different scenarios for how you would set up your environmental monitoring program. So baseline was kind of what the facility had come up with as their comfort best practice SOP. But of course, we have FDA's recommendation, the other industry recommendation to just randomly sample your environment. Some other folks say, oh, I'm just going to focus on zone 3 where listeria is most likely to be. And then we kind of proposed a model or risk-based approach that would kind of adapt depending on the sample results that you were getting over time. So again, here we're able to start conducting virtual experiments and kind of challenge, you know, mental models or what everyone thinks is kind of the best practice. The difficulty here was defining metrics for evaluating these interventions. So what is a good sampling? What is a high performing sampling plan? That was very challenging to come up with how you're measuring an effective sampling plan. So that also kind of challenged our mental models for how we come up with a success metric, for lack of a better word. Other examples of experiments we conducted were around corrective actions and understanding persistence in these environments. Okay, and then the last model I'll go through. So again, that one was highly detailed, but not very scalable, right? We weren't able to use that for multiple facilities. It was pretty specific for a single facility. This model still focused on listeria in frozen food, but this is coming from the perspective of actual illnesses in frozen foods. Right after bluebell outbreak and frozen vegetables, the industry thought, okay, so consumers aren't actually consuming these products as we thought they might, right? They're putting them in smoothies or they're putting them in salad. They're not cooking the vegetables. Or in the case of the ice cream, they made it into a shake, but they didn't eat the shake right away. It was left in the refrigerator. So those kinds of use cases actually would increase the risk if there was even low levels of contamination there. And even us as consumers might say, okay, yeah, I sometimes don't follow the packaged cooking instructions, right? So we can see this is actually an initiative under that Healthy People 2030 program. This is, I think, mainly looking at meat and poultry, but we can see here, 42% of consumers correctly follow, cooking to temperature, cooking instructions. And so if we kind of assume that's the same for frozen foods as well, the question from the frozen food industry was, okay, I am not handling my environment as a ready to eat environment, but should I be? Is the way the consumers are using my products actually ready to eat? And if I have listeria in my environment, is this actually a risk? So the way we could help answer this question is to actually build a quantitative microbial risk assessment model. So this is probably the more traditional model maybe you're aware of. However, instead of looking at illnesses on a population level, like traditionally a quantitative microbial risk assessment tool will look at out of the US population, what is the risk of illness from listeria and frozen food. And then you would look at overall consumption data. We were focused again on trying to give a processor a tool that they could use to make a decision on whether to update the controls in their facility, or perhaps, not release a lot of product if it has potential contamination. So this is a tool that's in Excel using the at-risk plugin. And I guess on the left, I'm showing you the kind of the steps or the inputs for this kind of model. So again, thinking about just a single production lot. And if we are doing a certain finished product testing protocol, we can, depending on the results of that test, we can extrapolate an estimated prevalence and level of contamination. And then depending on the serving size, number of servings per package, number of packages in a production lot, and assumptions around, the probability that a serving is actually cooked or maybe left out at room temperature to thaw. And then lastly, like whether your consumers are from the general population or actually a highly susceptible population. So again, in the example of the Bluebell ice cream outbreak, they were supplying a cancer unit at a hospital, right? So that's going to be a very different population than just general consumers. And so those are kind of the inputs and that they could put, and we made just a user interface on the first tab of the Excel file where they would enter that information, determine the number of simulations that they want to run, click run, and then we were giving them the results directly in that spreadsheet as well. So this was very accessible, easier to validate. The inputs were more accessible, just generally easier to use and interpret. And we actually were able to, do a workshop with the industry around this and help them understand whether their finished product testing protocol was appropriate, would catch this. The outputs here were interesting because we were giving them the actual number of illnesses associated with the production lot. And you'll see here in this top table, we'll give them the spread of that output because we can capture the variability here, giving them the median number of illnesses per lot, but also the 95th, 99th, and 99.9 percentile. And not giving them an okay or needs revised kind of result, just giving them the number of illnesses, which was difficult because we learned that industry actually doesn't make a business decision around a threshold for illnesses. Like no one's going to say, yeah, we're okay, even though we know as food safety scientists, there's no zero risk ever, but they're not going to say, okay, yeah, 1 illness is okay, 10 is not okay. So again, trying to refine, challenging our mental models on what is the data point that's needed, and what is the output that's going to be actionable. Maybe it's not illnesses. Is there some other metric here? But certainly quantifying risk that we wouldn't have and otherwise without a modeling tool like this. So those are kind of 3 different models in different scalability and complexity that again, we're more on a research phase. We did, go through some workshops, try to put them in front of industry members. But really set us up for this last case study I'm going to walk through very quickly because I see we have about 15 minutes left. During the pandemic, so now at iFood, this is a project that we recently worked on during the pandemic. We all experienced this during the early days of COVID, right? Supply chains were disrupted due to worker illnesses upstream in the supply chain. Processing was impacted, so products were just not moving through to retail. USDA was worried about this, right? This highlighted a lot of vulnerabilities in the global food supply chain that led to really unprecedented, not only human health impacts, but food waste, right? You see products were being left to rot in fields, farmers were dumping milk, animals were being euthanized, and then food shortages. Food was not available at retail. So there was a call for rapid response to help minimize impacts of COVID-19 on agriculture, and we participated in this project to try to use computer models and outreach, the same kind of mindset, but to help organizations develop contingency plans for ongoing or potential future worker shortages or disruptions that would impact the supply chain. And we were looking at produce farms, so harvesting operations, but also processing facilities of produce, dairy, beef, pork, and poultry. And so we used a similar agent-based model approach as the Enable model, but made it a bit more generic so that anyone could use it. So this is a Find Cove Control model, food industry COVID-19 control. Essentially, we were modeling not the environment, but the workforce. So, and then testing out different intervention strategies that you could implement in your facility or your operation related to your workforce. So you would set up your employee population and your initial case of COVID. And then we would simulate production activities that might bring workers in contact with one another, which may or may not spread infection. I'll just play this in the background. So this is actually a scalable website that is hosted. You can check it out on your own time. iFoodDS, so Cornell built the model in the background, and iFoodDS made the user interface. We've got some information on the model on the website, but really it's an interface where you can input your you can select the model here you want to run, and then you can input your information for number of workers you have, how are they divided into crews, what are their work shifts, how many days do you want to simulate, how many are vaccinated. Those are kind of some of the examples of the inputs. And then we're testing 12 different intervention strategies like temperature screening, rapid testing, vaccination, physical distancing. And the types of outputs we're giving, if I can fast forward, are number of infections over time, likelihood of shortages, labor shortages over time, your production capacity based on infections. And then a unique component this time, in addition to the public health outcomes, like with the frozen food model, we saw, okay, maybe illnesses wasn't the right metric to give them. This time we said, well, let's include some economic analysis. What's the cost of the intervention? Maybe if we give them a combination of public health impact and economics, cost of an intervention or production, cost of not being in production, maybe that would help them make decisions. And then the website also had an ability to kind of send feedback to the team. So we were able to try to gauge, how's this model being used? What would be more useful? And so that helped us, kind of conduct some user feedback interviews. Right here, I'm just summarizing some of the sound bites that we got. This is a wonderful tool. Timely information. We want to be preventing labor shortages. We could be running this monthly with updated data to stay on top of looming outbreaks. We would want to kind of use this over a planning horizon, so we might be able to react sooner. This data can be used to inform discussions with leadership, right? Food safety folks were sometimes the people that were taking on the COVID control for an operation, and having to go back up to senior leadership to justify decisions to take. And oftentimes data, everyone that was so new that data to support that was lacking, right? We were kind of just all following whatever guidance was out there. And so we can, similar to other food safety problems, we need some data out there that's hard to get. Simulation tools can kind of give us at least a data point to go off of. More specifically, those results tell me the top interventions that can eliminate 80% of labor shortages. So of course, it still wasn't perfect. Just very quickly, some of the weaknesses or other things that we can think about in the future is, we kind of just stopped at farms and facilities. The retail and food service sectors, we're also looking for tool. The data we thought would be used kind of, what do I need to implement now? And most of the conversations said, this would be more useful in a preventive kind of planning phase compared to crisis mode. This is still somewhat complex to understand and sit down and go through. So it'd be better to have this ahead of time when we're thinking about just planning for something like this to happen. The language and the results, we were kind of targeting an executive level user who VP or corporate user, but realized that they're not the people that have this information about facilities, right? So they were often passing this down to the actual operations folks in a facility or even an HR person. And so that kind of changes how we might be presenting some of this information and the data that is coming out of the model. And particularly they're asking for kind of an executive summary that they could then send to the higher ups. And the most utilized plots were those time series of infections and absence, that visualization of the peak of an outbreak. And then lastly, the economics model wasn't necessary. And maybe it was just, for this particular case, they were like, we don't need, you don't have to convince us with economics that we need to control COVID-19. We already know that our optimal situation is having all of our lines running. So I think we're still searching for what I certainly am, how do these facilities make these difficult decisions? What data, if they want to have a data-driven approach, what is that data that they need? But just to circle back on the key uses, that visualization, but also we heard for the first time quantifying risk, but perhaps it's really enterprise risk planning that this is positioned to have the most impact on. So I'll wrap up here just to summarize. From the first section, explore the fields of data science and product management if that's of interest. I feel like they relate somewhat to food science curriculums and the need for development of new food safety tools, whether you're at an organization that's big enough to develop their own tool, the Walmarts of the world, they have their teams that are developing their own solutions, Nestle's of the world, or at a vendor like a software company. And then the second section, all models have limitations, but they can help us to visualize these complex systems, challenge our mental models, identify knowledge gaps, and experiment with risk reduction practices. And lastly, they may not change day-to-day routines, but rather support long-term planning, large-scale decision-making to minimize business risks. So, we're not there yet, but I'm still hopeful that we'll find a way to, make some of these tools more available, by 2030, maybe. So with that, I apologize. Left maybe only 6 minutes for questions, but I'll open it up for any questions. My email is also here on this slide if you want to reach out. And with that, I will stop there. I'll check out the chat.
Well, thank you, Dr. Zoellner. Armand had a question. He was curious to hear whether any of these models are being considered as a basis for integration with AI platforms.
So I think not formally, but I think the enable model, these agent-based models generate a large enough data set to integrate with something like an AI platform. I still think that we don't have a large enough publicly available food safety data set to leverage a lot of those tools and platforms. But those kinds of agent-based models are generating a data set that is large enough to start looking at those. And yeah, that's kind of how I would.
I would encourage all your students to put on your cameras up and to take note of Dr. Zoellner's contact details, because this is how you find your jobs. And this is the opportunity for you to ask a question. So I'll set that question up and maybe you can follow up. So Dr. Zoellner, did you know when you went into food science that this is what you were going to do?
No. I'll tell you all, I'm from Chicago. I wanted to work at McDonald's. Like that was my dream. I want to go work at McDonald's and manage their, food safety program across their supply chain. The types of companies that would come give info sessions at Illinois and Cornell, or the Pepsi, Kraft, Frito-Lay, Sara Lee. I worked at Hormel. So, I knew about product development. I knew about quality assurance, but definitely never thought I would be working for a software company. But I think that's, the industry has changed since I got my bachelor's degree. And, this is a hot area that the industry is still trying to figure out. And so I think it's definitely an exciting career pivot. Not sure still whether, I aspire to be a VP of product. I somehow feel like I, might make my way back to a traditional food safety career, but certainly it's giving me skills in understanding from a different perspective, food safety management, data management, getting to work with a lot of different kinds of facilities and operations. And honestly, it was hard to get into industry having a PhD, entry level without a lot of industry experience, right? So we have senior management with PhD in a lot of big organizations, but they've got 10 or 15 years of industry experience. So coming right out of a PhD and trying to get into these companies in an entry level position, they're like, well, we don't really need a PhD to be a food safety manager. So I did have a challenge of finding a right fit going from academia to industry. And so part of it was, okay, well, maybe this is a fit, working for a software company, getting exposure to a lot of different companies and understanding a bit more at a technical level, how they manage their food safety program. So hoping it's giving me some industry experience to make a next career move.
Thank you. I see 2 hands up, and that's delightful. Why don't we take Behzad's question first and then you guys?
Sure. Thank you very much, Claire. It was a great presentation. I enjoyed it. Claire, what is the best way to evaluate these models? I know that, hearing from your customers that, this model was great, this tool was performing nicely, but how do you measure the success of the model? And the second part of my question regards how much data you need to develop these models.
Okay, so first question, how do we measure success? That's a very good question. And that's something that, I think, we have to have good partners that are willing to try this out and be transparent about how it helps them make decisions. And unfortunately, we did run into a lot of organizations that are dealing with listeria problems, for example. Their legal departments are like, we don't really want you to simulate this. And so that was a challenge that I didn't mention, is how simulated data might be used against an organization if it's almost suggesting there is a risk if they don't do something, if they don't take action on a modeled result. What implications does that have from a legal perspective? So some organizations see these tools as more of a liability, which certainly limits our ability to do a case study and say, okay, they had an issue, we ran the model. Ideally, we say, okay, they've got an issue, they run the model, it suggests you do this, we do that, and then we see a we are addressing the issue. We've conducted that again in a research phase, but we haven't been able to implement that with an actual industry user. So that is definitely something that would be great to pursue. Your second question was
How much data?
how much data you need. Okay. So that depends on the model. So of those three, certainly the agent-based model, I guess, I don't know if you're talking about for validation or to build the model versus somebody wanting to run their scenario. But for building the model and validating the model, typically, the agent-based model had the most data needs, and I guess the quantitative risk assessment model had the fewest inputs and validation needs. I don't really know a good way to answer that question, but typically you want to have a big enough data set so we can split it and use part of it to build the model and part of it to validate the model. So and that's the other challenge of, I talked about parameterizing these models. Typically we're building a model after we've run experiments at a benchtop scale. So over here, there's people doing research on growth of microorganisms on surfaces and in products, and transfer data on surfaces, and it's not exactly how we would implement a mathematical model. So ideally, we can be building a model at the same time we're doing experimental design, so that the parameters that we need are actually represented in the benchtop work that's also being conducted at the same time. And so because it's challenging to run these microbial experiments, usually, you do 3 biological replicates, right? For a model, we usually say like 3 data points is very hard to build a model off of. So we're trying to pool a bunch of studies that might be on the same microorganism in the same product. And so then, of course, you have to manage variability from one study to the next. So you can just kind of see how coming up with a single parameter to represent, all the complexity of how microorganisms, behave in complex matrices or on surfaces is just very challenging. I'm not sure I answered your question.
No, thank you. It was great.
Uday?
Hi, Dr. Claire. It's really informative, and I'm really interested in your work. So can you hear me?
Yeah.
Seems like I'm not, yeah. And in the meantime, I quick read your publications. I have a quick question about the agent-based model. So in that model, you also include both the environment and the employees. So would that, like, the people are also included in that mathematical model, but everybody, like every employee, act differently? So would that be a big variable in that model when validate that?
Yeah, so I explained these models at a pretty high level. If you look into that paper, there's a lot more detail. So for the enable model, we were, as you mentioned, focusing on the environment and the employees. So we weren't modeling the food, we weren't predicting actual contamination in food products. So that was kind of a limitation in that model, but just to think about Listeria persisting in the environment, we focused on the environment and the employees and Listeria species also, not all the way down to Listeria monocytogenes. And you're right. So all the employees might behave very differently, but that's the core piece of an agent-based model, is that we don't actually say how each employee behaves. The way we implemented it was, if you go to a food processing facility, most of the line workers, they're stationed at a line, right? So they might all move around at the beginning of the shift and at the end of the shift, but for the most part within a shift, most of the employees are stationed on the production line and they're doing repetitive behavior. So we captured where they're at during the production shift. And you'll see, I don't think I'm sharing my screen. I don't know if I'm sharing my screen anymore. I guess I could go back, but we had those links.
You are showing your screen.
Okay, so
All you have to do is go down to your, yeah, there you are.
okay, so let's see, here we go. So the employees you can see here during a production shift. So it's Monday, it's the production shift. We've got our employees mostly stationed here. This is a kind of a network, we call it. So there's links of where the employee is mainly working. And along these links, we assume based on if this is a zone 1 or a zone 2 or a zone 3 surface, the likelihood that the employee is actually going to contact it, and if Listeria is there, the likelihood that they would pick it up and move it somewhere else. So the rules were all based on probabilities, and the way that an agent-based model works is we say 20% chance that if an employee is standing here and touches a surface, it will actually pick up Listeria. Every hour, our time step of the model is an hour, the agent-based model is going to generate a random number. And if that random number is less than our probability, then the event happens. So that's kind of how you get, not every employee or agent is going to behave the same time. We just put these rules in the background, and then we're essentially just rolling the dice every time that something could happen. So yeah, I don't know if that helps answer your question, but
yeah, it seems like a trade-off, but it really makes sense. Thank you so much.
Yeah, so in the COVID model, we didn't put these restrictions here. We didn't say, the employee is stuck at this physical location. We put in a context structure, and we said, okay, depending on their role in the facility, they're likely interacting with employees on their same crew and their manager, but they're probably not interacting with employees on another shift or another line or another crew. So that was kind of another approach to modeling employee behavior. Yeah.
Any other questions? Well, Dr. Zoellner, thank you for a delightful presentation.
Oh,
And
thanks everyone.
Thank
really
you very
thank you.
much.
Cindy, take it away. It was a
Just
great
wanted to
presentation.
extend my thanks. Outstanding presentation. Thank you for taking the time, and enjoy the rest of your afternoon.
Thank
Yeah,
you.
thanks everyone
Bye,
for having
everyone.
me. Take care.
Thank you. Bye, everyone.
Bye, everyone.